Hello, and thank you for joining us. I'm Sandy Potter, here again with Masonicare President and CEO, JP Venoit, Dr. Ronald Schwartz, our Senior Director for Continuum Health Services, and we're very happy to have Sierra Drevline with us once again. She, of course, is the Director of Employee Health Services for Masonicare. Welcome back to you all, and happy February.
Thanks for having us.
Dr. Schwartz, we are learning about a new COVID subvariant that they say may be even more contagious than the already highly transmissible Omicron. What are you hearing about this?
Well, Sandy, you're right. Every week we were just talking about how many shows we've been doing, now every other week. And I guess our goal here, at least, is to try to keep you updated as much as we can and keep you informed with the latest developments. And there is a new variant. I have an article here, and once again, I try to summarize a fairly lengthy article that we come up with so that it's not so much information. But the title of the article is "The Latest COVID Variant is 1.5 times more contagious than Omicron and already circulating in almost half of US states." So I'm going to summarize this for you. There's some quotes in here as well. And, they actually start with certain key points, 3 key points. And the first one, they say the Omicron subvariant known as BA.2 is 1.5 times more transmissible than the original Omicron strain, according to Danish scientists. And the second point they make is the UK Health Security Agency said BA.2 has a substantial growth advantage over the original Omicron known as BA.1. And finally, they say nearly half of US states have confirmed the presence of BA.2 with at least 127 known cases nationwide. But now we're going to talk a little bit about this actual subvariant, and I think it'll make a little more sense to you. So the article starts like this. They say, the subvariant is 1.5 times more transmissible than the original Omicron strain, referred to by scientists as BA.1. And this comes from Statens Serum Institute, which conducts infectious disease research in Denmark. So a lot of this study is from Denmark. The new sublineage doesn't appear to further reduce the effectiveness of vaccines against symptomatic infection, according to the UK Health Security Agency. So that's important, but vaccines are still effective. And this was a quote from the CDC spokesperson. Her name is Kristen Nordlund, and she said, currently there is no evidence that the BA.2 lineage is more severe than the BA.1 lineage. So that's important. So to go further, BA.2 overtook the original Omicron as the dominant variant in Denmark over the course of a few weeks. And this was a statement by Troels Lillebæk, and he's the chairman of the Scandinavian Nations Committee that conducts surveillance of COVID variants. So BA.1 and BA.2 have many differences in their mutations in the most important areas. In fact, the difference between BA.1 and BA.2 is greater than the difference between the original wild strain and the Alpha variant, which was the first major mutation to take root across the world. So the BA.2 variant has 5 unique mutations on a key part of the spike protein, which the virus uses to attach to human cells and invade them. And you remember, even going back 2 years ago or close to it, the key part of this coronavirus is a spike protein. This is sort of the core where mutations happen. So to go further, the UK Health Security Agency on Friday said BA.2 has a substantial growth advantage over the original Omicron. The sister variant spread faster than the original Omicron in all regions of England where there were enough cases to conduct an investigation. However, a preliminary assessment found that BA.2 doesn't appear to reduce the effectiveness of vaccines any more than the original Omicron. A booster dose was 70% effective at preventing symptomatic illness from BA.2 2 weeks after receiving the shot, compared to 63% effectiveness for the original Omicron strain. I think that's a very important point because it still emphasizes the importance of vaccinations and getting booster shots. So we're now in the final parts here. So the World Health Organization has not labeled BA.2 a variant of concern. However, World Health officials have repeatedly warned that new variants will arise as Omicron spreads across the world at an unprecedented rate. And finally, Pfizer and Moderna started clinical trials this week on Omicron-specific shots amid growing concern that new variants will emerge as immunity induced by the original vaccine wane. So again, I think part of the take-home message. If you're in a community or living in a country where you have low vaccination rate, then you'll certainly have more admissions to the hospital and more severe cases, and then unfortunately more going to the ICU. And finally, in the United States, about 67% of those eligible are fully vaccinated, according to data from the CDC. So I think even though, we're tired of all this and it does get worrisome to keep hearing subvariants of other variants, they do appear to be milder, even though they may be more contagious. They definitely have a lower rate of spread with vaccinations and with booster shots. And I think that's the take-home message. So now comes my inspirational quote for the week, or the every other week. And it says, "Faith is taking the first step, even when you don't see the whole staircase." And that was actually said by Martin Luther King. And I thought that was a very important quote, because we all need to have faith in each other and in the data, and to just kind of believe that we keep taking steps forward, and eventually we'll get to the top of the staircase and be, in control of this pandemic once and for all. So again, I thank everybody for their diligence, hard work, perseverance, despite being fatigued, and dedication to our residents, and once again, health and peace. Thank you.
Thank you so much, Dr. Schwartz. You're always there with us every step of the way. And Sierra, now we are a few days past the COVID booster deadline for all of our employee team members. Can you give us an update on how that went, and also remind everyone about your upcoming family clinic?
Yes, absolutely. So the booster clinics in the last month and a half have yielded fair attendance. The recent Omicron surge has affected attendance related to guidance from CDC on when someone positive or on quarantine can receive the booster. So we're navigating through compliance for these folks as we collect documentation for booster doses. And we have one more clinic, the second family clinic coming up, and that's February 12th. And we'll see dose 2 and boosters given on that date. That's hosted by Nutmeg Pharmacy, and we've had a lot of success with them. We enjoy that partnership. So after February, we continue to plan for more clinics, and I'm very encouraged to hear that Pfizer is coming out with a new version of their vaccine. So very excited about that. And I wanted to just touch upon how the clinic January 22nd went, that family clinic. That one was very nice, very successful. A lot of families attended, and we saw children getting vaccinated, and it was very, very good. Good attendance and enthusiasm, really. So it's nice to see that. And we continue to plan clinics for our staff and for our residents throughout the spring, and we will get more information about those when we schedule them. So thank you very much.
Thank you so much, Sierra. That's a huge job, and we really appreciate it. And finally, JP, as many folks already know, Governor Lamont issued an executive order requiring all nursing home visitors to show proof of a COVID-19 vaccination or a negative test result. How is that process going for us here at Masonicare?
Sandy, that process was started really 2 Saturdays ago, and we didn't see too many individuals really give any pushback, if you will. If anything, many of the people that took the test were very happy that it was a way in ensuring the safety of those that they were coming to visit. So we've actually done very well. I will tell you that at one of my calls that I had with an organization that has other nursing homes, they actually had 2 visitors show up that ended up testing positive when they took it. So as much as it may be a little bit of a difficulty, people saying, geez, I got to get this test, it's proven to work. So we've had, not us, but 2 other nursing homes have seen individuals who have tested positive. Had we not done this, the likelihood of those people going to visit their loved one could have had the possibility of spreading it. So this is a great tool to protect those that we're entrusted to serve. And I know I always say this, but kudos to the staff. They did an absolutely amazing job mobilizing, getting it situated that they were able to do it. But just kudos to the staff for everything that they're doing. It's been a big battle, and they've done a fantastic job. And I would like to thank Sierra for all that she's done. These clinics have been a large undertaking, and it's made a difference. Our staff have gotten their boosters. We've seen so many individuals get their boosters. And when you think about the positivity rate in the state of Connecticut, it continues to drop, and it is dropping in a very positive direction. And we attribute that to those that have gotten their vaccines, those that are looking to get their vaccines. And when you think about the percentage of those in Connecticut that have the vaccine, it's a very high percentage. And we are doing very well out in the state of Connecticut, but also internally. Our staff, our residents, and those that we serve all are doing a fantastic job in getting the vaccine, getting the booster, and fighting it. I will tell you, because of all of the drop in the positivity rate, and also so many of our staff and our residents with the booster, we're going to start seeing some of those restrictions that we put in play start to diminish. And I will tell you, in the next few weeks, those restrictions will be lifted. Many of them will be lifted. As an example, dining will have less restrictions than they do today. So it's definitely looking at a very positive approach to how we've combated it, but also how we can continue to get to that normalcy that we're really looking for. So thank you to everyone on this video, but thank you again to all the staff and the residents and the family members for really helping us fight through it. It's truly been an amazing journey. I will tell you, not a great journey all the time, but there's been so many positives also. So thank you.
That's great, JP. Lots to be hopeful for. Well, thank you all so much for sharing your time and your insights with us today, as always. And of course, we thank you for joining us at home. Until we see you next time, we hope you'll stay safe and stay well.